Most people think strokes announce themselves. Sudden facial drooping, an arm that won't lift, words that won't come. A dramatic, unmistakable event that sends someone rushing to call for help. That's what the textbooks show. That's what most people expect. But after 60, the most dangerous forms of brain damage are the quiet ones, the ones that build slowly while you sleep. No warning, no time to call for help, no second chance. What shocks most of my patients? These events are almost always connected to something ordinary, something you did before turning off the light. My name is Dr. Marcus Reeve. I'm a neurosurgeon. I've spent over 20 years operating on brains damaged by stroke, by oxygen deprivation, by the slow erosion of vascular disease. I've also spent 20 years watching the same preventable patterns repeat themselves in patients who had absolutely no idea what they were doing to their brains every single night. Tonight, I'm going to show you 5 of those patterns. 5 nighttime habits that are quietly loading the gun while you sleep. And then I'll show you exactly how to unload it one simple evening at a time. What you learn in the next few minutes may be the most important thing you hear this year. Here's something most people don't know about the sleeping brain. Your brain doesn't take a break when you fall asleep. It shifts into its most important maintenance mode of the day. The glymphatic system, the brain's waste clearance network, opens up almost exclusively during deep sleep. Cerebrospinal fluid pulses through channels around the brain's blood vessels, flushing out the metabolic waste that has accumulated over the waking day, including amyloid, the protein associated with Alzheimer's disease. At the same time, your blood pressure naturally dips 10 to 20% below its daytime levels. Your brain's blood vessels relax. Inflammatory markers drop. The system runs its essential overnight repair cycle. But after 60, that system becomes less reliable. The blood vessels stiffen. Pressure regulation becomes less precise. Certain hormonal signals that used to protect the brain at night begin to weaken, and the margin for error gets much, much smaller. Here's what makes the night genuinely different after 60. During the day, your brain's blood supply has backup mechanisms, collateral vessels, the ability to compensate quickly. At night, many of those compensatory mechanisms are reduced. The brain is running, in a sense, on a minimal support crew. The hours between midnight and 6 in the morning carry the highest concentration of strokes and major cerebrovascular events. Not the afternoon, not the morning rush. The quiet hours. And what happens during those dangerous hours is largely determined by what you did before bed. Let's start right now. Habit number 1. Eating a heavy meal late in the evening. Let me ask you something. What time did you eat dinner last night? And what was on the plate? I ask every patient that question, and for a surprising number of people over 60, the answer involves a full meal somewhere between 8 and 10 at night, followed shortly by the couch and then bed. I understand why it happens. Long days, busy schedules, the habit of a lifetime. But from a neurovascular standpoint, this habit is quietly harming your brain every single night. Here's what's happening inside your body when you eat a large, late meal. Your digestive system demands an enormous increase in blood flow to the gut. Your heart rate increases. Blood pressure rises. Your blood triglycerides, the fats circulating in your bloodstream, spike sharply within 2 to 4 hours of eating. Now layer that on top of going to sleep. Your brain expects the evening to be a wind down. Instead, your cardiovascular system is managing a full digestive demand while simultaneously trying to shift into its nighttime maintenance mode. Those two demands are in direct conflict, and in a brain that already depends on precise, stable blood flow through small vessels that have less reserve than they once did, that conflict creates real consequences. Elevated nighttime blood pressure driven by late meal digestion puts mechanical stress on the brain's small vessel walls during the hours they are most vulnerable. Triglyceride spikes following late meals increase blood viscosity. Thicker blood moves more slowly through already narrower vessels. The research is consistent. Eating within 2 to 3 hours of sleep is associated with elevated nighttime blood pressure, reduced deep sleep quality, and increased risk of cerebrovascular events during sleep. The fix is simple. Finish your main meal by 6 or 7 in the evening. If you're genuinely hungry later, keep it light. Protein, vegetables, something that doesn't require your cardiovascular system to mobilize for a major digestive effort. Does your dinner schedule look anything like what I just described? You'd be surprised how many people answer yes and have never once connected it to their brain health. Habit number 2, taking blood pressure medication only in the morning or skipping it. This one is critical. In my clinical experience, it's where most preventable brain damage occurs. If you are over 60 and you take medication for high blood pressure, which statistically describes more than 60% of people in this age group, the timing of that medication matters for your brain enormously more than most doctors take time to explain. For most people, blood pressure follows a predictable pattern through the day. It rises in the morning, peaks in the afternoon, and dips at night. That nighttime dip is protective for the brain's blood vessels. It gives them hours of reduced mechanical load, hours to rest and recover. But a significant proportion of people over 60, particularly those with hypertension, don't get that nighttime dip. Their pressure stays elevated through the night. Or worse, it surges during the early morning hours, the period between 3 and 6 a.m. when cerebrovascular events are most common. This is called nocturnal hypertension, and most people have never heard of it. And it is dangerous in ways that daytime high blood pressure is not. Here's why the brain is so vulnerable during those hours. The brain's small vessels are not braced for impact during sleep. A pressure surge at 3 in the morning hits their walls differently than one at 3 in the afternoon. It's more likely to rupture a fragile vessel, more likely to disrupt the thin walls of the small arteries supplying the white matter, more likely to trigger clot formation in an area the brain cannot afford to lose. If you take your blood pressure medication only in the morning, it may wear off precisely when you need it most. If you skip it entirely, you may be leaving your brain completely unprotected during its most vulnerable hours. The conversation to have with your doctor is this: should my blood pressure medication be taken in the evening rather than the morning? There is strong evidence, including the Hygeia chronotherapy trial, showing that evening dosing of blood pressure medication significantly reduces the rate of major cardiovascular and cerebrovascular events during sleep. That is not a minor adjustment. That is a potentially life-altering conversation that takes 2 minutes. Most patients over 60 have never had it. You can have it at your next appointment. Habit number 3, undiagnosed sleep apnea. I want you to think about someone you know who snores. A partner, a parent, maybe yourself. That sound, that loud, irregular rumbling through the night, most people treat as an annoyance, something to elbow your partner over, something to joke about at breakfast. I treat it as a brain health emergency until proven otherwise. Sleep apnea is one of the most underdiagnosed conditions I encounter in patients over 60. It is estimated that more than 30% of older adults have some form of it. The vast majority have never been diagnosed. They have no idea what it is doing to their brain every single night. Here's what actually happens during an apnea episode. You stop breathing for 10 seconds, 30 seconds, sometimes longer. Your brain registers an oxygen crisis. It fires off an emergency stress response. Adrenaline surges, heart rate spikes, blood pressure jolts upward sharply. Your brain is chemically wrenched out of its deepest, most restorative sleep stages, while your body remains still. This happens not once per night, dozens of times per hour. Now think about what this means for a brain that needs deep sleep to run its lymphatic waste clearance cycle. Every apnea event disrupts that cycle. Waste products accumulate that would otherwise be flushed overnight. Think about what repeated blood pressure surges mean for brain vessels that are already stiffer and less resilient than they were 20 years ago. Every surge is a mechanical stress event, repeated tens of thousands of times over months and years. The data on sleep apnea and brain health is unambiguous. It is strongly associated with elevated risk of stroke. It significantly accelerates the development of white matter disease and the small vessel damage I described earlier. It impairs memory consolidation, which requires deep sleep to function correctly. And it raises the risk of atrial fibrillation, which itself dramatically increases stroke risk. The warning signs are not always the obvious ones. Yes, loud snoring is one. But watch also for waking with headaches in the morning, feeling exhausted after a full night of sleep, needing to urinate frequently during the night, waking with a dry mouth, a partner who has observed you stop breathing. If any of those sound familiar, talk to your doctor about a sleep evaluation. For patients over 60 with any history of cardiovascular disease or cognitive concerns, this evaluation is not optional. It is part of your brain care. The treatment, most commonly a CPAP device, is not glamorous. I know that. Patients resist it. I understand why. But the data on what it does for brain health is compelling. Patients who use CPAP regularly show measurably improved cognitive function, reduced blood pressure, lower rates of new stroke events, and better preservation of white matter over time. One device, one habit, significant brain protection. Habit number 4, going to bed dehydrated. This next one often surprises my patients. The reason for it is completely logical. Many people over 60 deliberately limit how much they drink in the evening. The reason makes complete sense. They want to avoid getting up at 2 in the morning. Disrupted sleep is uncomfortable. Getting up at night increases fall risk, particularly in a dark room. So they cut fluids after dinner, sometimes after 4 in the afternoon. From a brain health standpoint, going to bed even mildly dehydrated is a meaningful risk factor. And almost nobody talks about it in the context of brain protection. When you are dehydrated, your blood becomes more viscous, thicker. It doesn't flow as freely through your vessels. For a young cardiovascular system, that's a manageable inconvenience. For a person over 60, whose cerebral vessels already have reduced diameter, reduced elasticity, and possibly existing plaque, this is a very different situation. Thicker blood moves more slowly through already narrowed arteries. it is more prone to forming small clots. And here is the timing problem most people never consider. During sleep, your heart rate naturally slows. Blood moves more slowly through the system. Your body is lying still for 7 or 8 hours. Circulation to the extremities is reduced. The brain continues its demand for constant, reliable blood flow. Now combine slow circulation, thicker blood from dehydration, a body that has been lying still for hours, and vessels that may already have narrowing from years of vascular risk. That combination is part of why strokes cluster in the early morning hours. It is not the whole story, but it is a real contributing factor. The fix is genuinely simple. 1 full glass of water before bed, 8 ounces. That is all it takes to ensure your blood isn't unnecessarily thickened during the most vulnerable hours of the night. Keep another glass on your nightstand. When you wake at 2 or 3 in the morning with mild thirst, that is your brain's circulatory system asking for something it genuinely needs. You don't have to choose between protecting your sleep and protecting your brain. Habit number 5. Sleeping in the wrong position with no attention to sleep quality. This last one I want to address carefully because it involves some of the newest and most fascinating neuroscience of the last decade. I mentioned earlier that the brain clears its waste products through the glymphatic system during deep sleep. Recent research has added an extraordinary finding to that picture. The glymphatic system appears to function most efficiently when a person sleeps on their side rather than on their back or stomach. Not dramatically more efficiently, but measurably. The reason involves the physical channels through which cerebrospinal fluid flows around the brain's blood vessels. Side sleeping appears to optimize the pressure dynamics of that flow. The clearance of metabolic waste products, including the precursors of amyloid plaques, appears to be meaningfully more efficient in this position. This research is still developing. I won't overstate it, but for a person over 60 who is actively trying to protect their brain health during sleep, side sleeping is a reasonable, free, zero-risk choice. There is also a direct connection to the sleep apnea problem I described earlier. Back sleeping dramatically worsens airway obstruction. The tongue and soft tissues fall backward under gravity, narrowing the airway. Simply shifting to side sleeping can reduce apnea events significantly in many patients, even while they're working toward a formal evaluation and treatment. Beyond position, this brings me to the broader point about sleep quality. After 60, achieving consistent, deep sleep requires protecting the conditions that allow it. A bedroom that is too warm forces your body to dissipate heat throughout the night. Your brain stays in lighter sleep stages. The glymphatic cycle is abbreviated. The optimal sleep temperature for most people is between 18 and 22 degrees Celsius, roughly 65 to 72 Fahrenheit. That range keeps your body in what physiologists call thermoneutral territory, where deep sleep is most accessible. Screen exposure in the hour before bed suppresses the melatonin signal that prepares your brain for deep sleep. Your phone, your tablet, your television. The bright light spectrum, particularly blue light, tells your brain it's midday. Your sleep architecture suffers. You spend less time in the deep stages, where the brain does its most critical maintenance. The combination of side sleeping, a cool room, and a screen-free hour before bed is not complicated. It requires no prescription. It costs nothing. And it protects the brain's single most powerful self-maintenance mechanism. Everything I've described may sound like a long list of things to worry about. I want to reframe that completely. Because when you look at all 5 habits together, what you actually have is a blueprint, a simple, practical evening routine that addresses every one of these risks, and it fits into a normal life without any dramatic changes. Here's how it looks. Between 6 and 7 in the evening, finish your main meal. Not a feast, not a fast, a proper dinner at a civilized hour. 3 to 4 hours before sleep, giving your brain's blood vessels time to settle. At 7, water and medications. If your doctor hasn't discussed the timing of your blood pressure medication, that conversation is your assignment for your next appointment. Evening dosing may be significantly more protective for your brain. Take that seriously. Between 8 and 9, begin your wind down. A gentle walk, some reading, a calm conversation. This is the time to step away from screens. Not as a vague health recommendation, as a direct intervention for your brain's overnight maintenance cycle. By 9, check your bedroom. Adjust the temperature. Set a glass of water on the nightstand. These take 90 seconds. They matter. By 10, you're in bed. On your side, not your back. One small positional choice that supports better airway patency and possibly better glymphatic clearance. Dinner by 7. Water and pills at 7. Calm evening until 9. Room prepared by 9. Bed by 10. On your side. That is a complete brain protective evening routine, and the research behind every single one of those steps is real. I want to be honest with you for a moment, not as someone making a video. As a neurosurgeon, I have stood in an operating room at 3 in the morning looking at a brain that had been silently starved of blood for hours before the person fell. I have spoken to families in hospital corridors at dawn who had said goodnight normally 6 hours earlier and had no warning at all. In case after case, the contributing factors were not mysterious. A late, heavy dinner, a blood pressure medication taken in the morning that had worn off by midnight, an airway that had been collapsing silently for years while everyone assumed the snoring was just snoring, a body that had been quietly running out of water since 4 in the afternoon. These are not exotic risk factors. They are not rare. They are the background noise of millions of ordinary evenings. And that background noise, accumulated night after night, year after year, can become a cerebrovascular event that nobody saw coming, because nobody knew to look. Here is what 20 years in the operating room has given me. Most of the brain damage I've seen in surgery didn't happen because of bad luck. It happened because of information the patient simply never had. You now have it. The question is, what you do with it tonight. Let's bring it all together. 5 habits, 5 fixes. 1. Finish your main meal by 6 or 7 in the evening. Not a radical change, a reasonable dinner at a reasonable hour. Your brain's small vessels thank you for the 3 hours of recovery time. 2. Talk to your doctor about the timing of your blood pressure medication. Ask specifically about evening dosing. That conversation may be the most important you have about your brain health this year. 3. If you snore, if you wake exhausted, if anyone has ever told you that you stop breathing during sleep, get evaluated for sleep apnea. At 60 plus, this is not optional. It is part of taking your brain seriously. 4. Drink a glass of water before bed. Keep one on the nightstand. Do not let your blood thicken overnight because you were trying to avoid a bathroom trip. Your brain's circulation is more important. 5. Set your bedroom between 18 and 22 degrees Celsius. Sleep on your side. Protect your deep sleep by stepping away from screens an hour before bed. Give your brain's glymphatic system the conditions it needs to do its most essential work. One more question for the comments. Which of these 5 habits do you recognize in yourself? I have a strong feeling at least 2 or 3 hit very close to home. You're not alone in that. Most of my patients recognize themselves in this list. The difference is that you now know what to do about it. If this video gave you something useful, share it with someone you care about who is over 60. A partner, a parent, a close friend, someone who hasn't yet connected their evening habits to their brain health. That one share might change something important for them. Take care of that brain. It has been working for you every single night without a day off for your entire life. Give it the conditions it needs to keep going. Everything shared in this video is general medical information based on current neuroscience research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medication schedule, please speak with your own physician first.